to be able to speak on a panel made up of so many people with great interest in this subject that we're going to explore. I have to tell you that next to Canada, Mexico is my favorite country. I've probably been here 10 or 20 times. I come here all the time on holidays. I admire the people. I love the beauty of your country. And I believe that forums like this are designed to help people come together and discuss issues that, quite frankly, cause a little difficulty with us all. I'm going to speak to you first of all about my experience as the mayor of Vancouver. I believe that although I'm a senator, that a municipal politician is the most important politician that we have. They're the ones that meet the rubber where it hits the ground. They are the ones who speak to the constituents continually. And they're the ones who I believe best can hear what citizens are going to say. In 2002, I ran for mayor on a platform that I would start the first supervised injection site in North America. And I came to this decision because of listening to people and citizens who were upset about the fact that addiction in our city was taking over the people, was taking over a portion of the city, and nobody was doing anything about it. For you to come to some sort of an agreement with me, we have to agree that addiction is a health issue and is not a moral issue, is not a matter of not having a good moral base. It's a disease. Alcoholism, tobacco, obesity, any of these are diseases and should be treated as such. So if you don't believe that drug addiction is a health issue, we're going to have some problems. In saying that, much like Mexico, the federal government is the agency that's responsible for drug laws. In Canada, the provinces are responsible for health. And so you can see where I'm going on this. I piggyback on the health end of it with the province and said, you know what? Insight, which is what the supervised injection site is called, will be a healthcare clinic. It will be funded by health in the province. It will be run by the health organizations in Vancouver. And we will get over this idea that it is some sort of a moral breakdown of a person who's using drugs. The citizens of Vancouver elected me in a landslide. And that says something because it means that they believe that this is a health issue also. And I was elected in November of 2002. In September 30th, 2003, we opened Insight. All of the arguments that were put out against it, that an injection site would cause people to gather, false. That it would cause more crime, false. There are 18 different papers that have been published on what happened with Insight, and I'd like to give you some idea of what they say. 12,000 unique individuals registered at Insight. Women made up 26% of the clients. Aboriginal people, First Nations people made up 18%. The daily average visits are around 600. It's open 18 hours. We have had, since it opened, over 2 million injections. Not one single person has died. Now, I was the coroner for British Columbia for 20 years, and I can tell you that between 1993 and 1996, I was averaging 200 deaths a year in Vancouver. Now we're down around somewhere around 50. One of the reasons we wanted to go to Insight was because our numbers of HIV and AIDS infections were the highest in the world. They were higher than New York City, and we believe that most of that was caused through needle sharing. To give you some example, 400 users were diagnosed with HIV in 1996. In 2012, 29. If you extrapolate that, if every one of those persons shared a needle, you can see what it would look like. It just goes out of control. Since we started this in-site, we've now got on-site. So upstairs we have a place where you can go to dry out. And above that we have a place where you can go for treatment. On site we have registered nurses. We estimate that we save probably $1.5 to $2 million a year in hospital expenses from persons with addictions having to go there to be treated for abscesses, to be treated for broken bones, to be treated for all kinds of things that we can take care of in the clinic. There have been 2,055 nursing interventions. At the end of the day, and this is important, at the end of the day, if I only saved one life, it would have been worth it. Because nobody can put a price on a life. And so we've gone through all of these arguments. Unfortunately, Canada, instead of going forward, has a government which tried to stop insight. We took it to the Supreme Court of Canada and we won, and now they're trying to set up a governance policy where we simply cannot, it will be too difficult to set up another insight. There's an election in 2 years, and I hope they're gone. I'll do everything I can to get rid of it. But this came about from a municipality dealing with a problem that was unique to that municipality. There was no place else in Canada, and probably no place else in North America, that was dealing with the problems like we had. And we had to go to Europe, to the Swiss, where we could take a look at how their programs work. As only the Swiss could express it, when I went there, they described drug addiction as a nuisance, that it was unsightly, it didn't look good, it gave the country a bad name. There was never any question that this wasn't a disease or that these people had some moral deficit. It was unsightly and a health issue. And so the municipality, in concert with the province, state in your case, and with the assistance of the then federal government, were able to come up with guidelines, were able to come up with a plan, were able to come up with how we were going to set up this insight in less than 8 months. And so it can be done. It can be done by the local politicians working in concert with their citizens.